An otherwise fit 74 years old man present with pain in the right hip following a minor trauma. On examination, his leg is shortened and externally rotated. Plain X-ray demonstrated displaced intracapsular fracture. This is very, very important point, that the fracture which is the displaced intracapsular fracture of the femoral neck. What is the best course of the action? That means it is the diagnosis is very complete. So we have to go through the treatment. Here are the options. Options are uncemented hemiarthroplasty, dynamic hip screw, total hip replacement, intramedullary nail, and percutaneous pins. So you can see the parameters or scenario. 74 years old man, that means the patient is very old but fit. This point is also important, that a fit man, 74 years old, and he developed displaced intracapsular fracture. What may be our action? So first of all, here we can see this is the hip joint, this is the acetabular component, and this part is the femoral head component. And here the definitive capsule present. Definitive capsule present from here up to here. So this is the capsular part of the femoral head or the hip joint, and the rest of the portion is the extracapsular part. So in this patient, fracture occur within this capsule, and what occurs actually, it displaced. That means when fracture occurs, fracture is not stable, the fracture is displaced. So in this picture here we can see this portion here, there is the loss of the normal concavity or normal angle of the hip joint, which is known as the Shanton line. So Shanton line changes and this femur is externally rotated, so there is the fracture of the femoral head. Now see the intracapsular. That means in this patient, the old man who is fit, and intracapsular fracture develops. So what occurs? So in case of elderly patient, there are two options. One of them is displaced, another one is the undisplaced. So what occurs in case of undisplaced? In case of the undisplaced in elderly, there may be option of the internal fixation. So in case of undisplaced, that means the fracture occurred but there is no changes of the shape. In this condition, internal fixation may be an option of the elderly person. But there is another option, which is the total hip replacement. So in case of alternative option, total hip replacement is another option. But here we should keep in mind that the patient is sick or better, the no cognitive impairment, medically fit. That means in case of all fit patient, they go for the total hip replacement. And if the patient is not physically fit, he is taking different type of the drug, and he is comorbid, different type of the comorbid condition present, and patient is not fit, he is not able to work regularly, in this condition, go for the hemiplasty. So in case of the elderly patient, in case of the undisplaced, there may be internal fixation or total hip replacement, but they have to be fit. So in case of the fit patient, total hip replacement possible and internal fixation possible. But in case of the sick patient, direct go for hemiarthroplasty, because the hemiarthroplasty, it is changes only the femoral head part. But in case of total hip replacement, there is the both changes of the acetabular part and the femoral head part. So it is the big operation or longer time operation. For this condition, in case of sick patient, total hip replacement usually not done. In this condition, hemiarthroplasty done. On the other hand, in case of young patient, in maximum case, go for the internal fixation. Go for the internal fixation by nail or other options. But when there is a severe displacement, in this condition, total hip replacement. So younger patient, always we keep in mind for the internal fixation, but there is a severe displacement, in this case, total hip replacement. And in case of elderly, if fit, then always try or maximum try to total hip replacement, and in case of unfit patient, hemiarthroplasty. So in short, In case of older, what we can do? In case of the fit patient, what we can do? We can do the total hip replacement. And in case of unfit patient, go for the hemiarthroplasty. So in case of elderly, for fit patient, total hip replacement, and for unfit patient, hemiarthroplasty. But there is another option, which is the internal fixation. It is less done. And in case of young, most of the time we have to keep in mind for internal fixation, but there is severe displacement. In this condition, total hip replacement. I think now it is clear. So in this picture we can see this is the hemiarthroplasty. That means this is the femoral head part. So when only the femoral head part introduced or inserted in this condition, this is called the hemiarthroplasty. In this picture and this picture also, here we can see only the acetabular head part, femoral head part. So when only the femoral head is replaced, then it is called hemiarthroplasty. But in case of the extra capsular, this is another important. That means which is the outside capsule, that means the below the capsule, then what may be the option? When this is the subtrochanteric, it is directly IM nail or intramedullary nail. Subtrochanteric, that means below the greater and lesser trochanter. In this condition, there is intramedullary nail is perfect. But when there is peritrochanteric, that means through the trochanter, greater trochanter and lesser trochanter, in this condition, dynamic hip screw is a option. So most of the time we will think for dynamic hip screw, but in case of the unstable patient and reverse oblique, 2 point, one is the unstable, another one is the reversible oblique. In these two condition, medullary nail, and rest of the condition, the dynamic hip screw. So peritrochanteric, we have to keep in mind that all of them usually dynamic hip screw, some part is by the intramedullary nail. In this part here, we can see this is the dynamic hip screw. Here we can see the IM nail also in the internal nail. In case of femur, here you can see this is the nail and it is going to the shaft of the femur. And this picture also, here we can see this is the intramedullary nail. So what is our option? Our option in this patient, as it is he is fit, although he is 74 years old, but he is fit. For this condition, total hip replacement is the best option. Other, here we can see it is the displaced intracapsular fracture. As it is displaced, so there is no option for the IM nail or total hip screw. In this condition, we have to go directly for the total hip replacement.